Brad Cox here from ACUMOBILITY, and I'm with Jackie Shakar, the head instructor at Graston Technique. And we're going to talk to you about how to quickly incorporate both Graston Technique and ACUMOBILITY for common diaphragm and breathing problems. So first we're going to show you a quick assessment and then get into a series of correctives starting with Graston Technique and then bridging to homework using the ACUMOBILITY techniques.
All right, so one of the reasons why the two systems, Graston Technique Therapy and ACUMOBILITY, work well together is because we both stress the emphasis on assessment, treat, and then reassess. Okay, so before we go into our actual work to the diaphragm and breathing apparatus, obviously we need to start out with an assessment of breathing. Okay, and quite honestly, as your client or patient is laying down or you're subjectively interviewing them, just kind of look and see where is the person breathing from. Okay, so obviously we want to see expansion from the lower rib cage, not just anteriorly but laterally as well. And what we should really be looking for is little to no movement of the upper rib cage. We should see little to no activity in the neck muscles because the effort here is minimal. You're just relaxing, and so we should just see some nice lower rib cage and diaphragm activation.
And just a quick thing, this is critical, right, for maintaining interabdominal pressure, right, for anybody who's going to go under load in their training, right, and for stability of the back, right, it plays enormous other roles, right. So broad technique is just to see where are they breathing, right, and then we're going to do something. Let's say Ryan isn't doing a good job belly breathing, right, which he is. That's what you would see, right, raising of the chest, very little ab movement, right, and a lot of neck muscle engagement. If we start to see that, that'd be a great indicator that, hey, maybe we've got a failure of diaphragm activation here, right? Now we can quickly know, is this just a stress pattern is he in, or is he able to fire his diaphragm by cueing him to, hey, try to breathe into your lower abs, right? Inflate around the tire. Now, he can do that. Let's say he couldn't. Then we're going to incorporate some techniques to improve diaphragm activation, and this is where we're going to bridge into the Graston technique and then the ACUMOBILITY techniques.
So what I'm going to do is take the instrument and we call this technique framing. So I'm going to just frame out the diaphragm. And for the sake of demonstration, I'm only working the right side. I would work both sides, obviously, in the course of a treatment. Okay? And so I would do this work back and forth, and then eventually move to a different instrument. Okay? And just kind of come in and scoop and pull. Okay? And we would try to incorporate the breath with the tissue work. Okay, so what I'd like you to do is take a breath in, inhale, and then as you exhale, we want to facilitate ribs down, and then just scooping the connective tissue. Perfect. Finish with both sides, and then obviously we want to facilitate what we do with homework.
And that's where we're going to incorporate two different ACUMOBILITY techniques into this, right? So we're going to bridge from the treatment, right, to the homework for the patient here, right? Now for this, we're going to start with the ultimate back roller, right? And we're going to use this to work up transverse abdominis, the lower ribs here, and then we're going to use it for resistance to do some diaphragmatic active breathing, all right? So Ryan is actually going to flip over, all right? And he's going to lie face down on the roller, and it's going to be working along the middle section here. Okay, now those bumps are really effective at getting into the bottom of the rib area there, and he's going to try to isolate some of those trigger points and restricted areas that Jackie was just working. Now, once he's done this for about 20 seconds, he's going to stop, and he's going to use the roller, right, as resistance to help activate the diaphragm and improve breathing mechanics. Okay, so he's going to actively try to breathe in and expand the tire all the way around here, using the roller here to provide resistance, all right, to actually improve his ability to activate. Okay, you can do 3 to 5 breaths there, and then we're going to graduate this up to the next level where we're going to do an even more pinpointed release. So after he's done a few breaths, we're going to switch out the back roller for 2 ACUMOBILITY balls. Now, here, we're gonna go find the bottom of the sternum, work down about 2 inches, just inside of the ribs here. You're going to place 2 balls on the ground, okay, right next to each other. So it's right on the edge. Ryan's gonna lie down, and he's gonna find that spot there, all right? He's gonna completely lie down. He's gonna bring his hands up over his head. And now, this can be really tender, right? So if it is, right, you can control the pressure by bringing your hands in, lifting off slightly, right? We never want more than 7 out of 10, right? And then we're gonna do those breathing techniques again. So now that he's on those spots, he's gonna actively expand, right, breathing into the balls. Right? This resistance here actually gives the diaphragm a feedback loop to help improve his ability to activate, and it builds on the Graston technique work, right, to further this as he goes home, right? And we would give this to him as either prep work before his training, right, or as part of a broader corrective exercise program to address whatever specific thing that we were working on in treatment. That's a great segue technique that incorporates both of those into one sequence.